In this episode, we're joined by Claudia Black, a renowned author known for her work with family systems and addictive disorders. We're discussing the importance of addressing childhood trauma and addiction recovery, the role of family, and practical approaches to long-term recovery. This is the Well Aware Podcast.
Hi, guys. Welcome to the Well Aware Podcast. I'm Dr. Lauren Grawert, Chief Medical Officer at Aware Recovery Care. Today, we have a really exciting episode focusing on the relationship between families, childhood trauma, and addictive disorders. I'm really honored to be joined by renowned author Dr. Claudia Black, who is internationally recognized for her pioneering and contemporary work with family systems and addictive disorders. So we're going to bust right into it. Claudia, thank you so much for joining us today. Could you start by telling us just a little bit about yourself and your background and your interest in addictive disorders?
Well, I've been working in the field of addictive disorders for over 40 years, maybe 45 years. I have to quit counting. And I love the work, absolutely love the work. And I came in as a very young social worker, a very naive. What I did come in with was a real strong belief that nobody deserves to live with the fear and shame that permeates a family affected by addiction. And I feel as strongly about that for the person who's addicted to substances as I do the family members. And that's really been a driving force for me. And I've done, over all these years, I do a lot of speaking, and I do a lot of writing books, but I also have always kept my hands in doing hands-on work, typically in residential treatment centers where there are addictions. And when you work with families affected by addiction, and you work with the addicted person, you end up working with a lot of things that in the beginning you don't realize necessarily. You end up working a lot with trauma. You end up working a lot with depression, anxiety, relationship problems, process addictions. And when I began my work, one, we didn't even use the word addiction back then. It was the word alcoholism. You were either a drug addict or an alcoholic. That's how separate we were. And in time, we morphed into chemical dependency to sort of bring all those people together. And so even our terminology changes, but certainly our understanding of not just substance addictions, but process addictions has evolved. And certainly the neurobiology of what goes on, not just for the addicted person, but even for the family member, has been a real asset to our field.
Yeah, and you talk a lot about the relationship between childhood trauma specifically and folks being more vulnerable to develop addictive disorders or behaviors later in life. And I think actually you were one of the first pioneers, clinicians, who was vocally talking about this and putting out work on this. Just the past 2 or 3 years, there's been an avalanche of studies and data supporting your thesis about that connection there. But can you kind of tell us a little bit about how childhood trauma can predispose somebody or make somebody more vulnerable to develop a process disorder or addictive disorder later in life? What's that connection like?
Well, probably what we call the Adverse Childhood Experience Study that started back in 1995 has been the biggest validator for what it is that we were, myself and a handful of others, were recognizing back in the late 70s and the 1980s. And that the greater the number of, as I say, adverse childhood experiences somebody has, the more likely they are to experience problems with all the things that we see in the addictions field today. And I think that what we have failed to recognize, and what my rework was about, was recognizing that as a child growing up, we developed survivorship skills. And we have the ability in which to look good to the outside world. But what people didn't recognize was how much internalized shame, how much loathing was happening for the part of the child. What they were recognizing was their wonderful survival mechanisms, all their defense mechanisms, and they weren't even seeing them as defense mechanisms. It was like, oh, wow, they're doing just fine in spite of. And the reality is they are not doing fine in spite of. You can be raised and be impacted by trauma and certainly have some resiliency. And we saw that resiliency, but really not understanding what their experience, what was really happening internally for them. It was very easy to just go into our own denial that somehow they're not nearly as affected as possibly the very angry a kid. Now, today we talk about trauma responses being fight, flight, and freeze. And for a child raised in the home where there's addiction, as they move into their adult life, you begin to see how that fight, flight, and freeze becomes acted out. Because acted out in their own need to medicate is the biggest way it's acted out. Their own need to medicate and anesthetize those core beliefs that say, I'm not worthy, I'm not good enough, there's something wrong with me, you can't trust other people. They acted out, not just sometimes in their own use of substances, but other compulsive behaviors. But we see it in self-defeating behaviors. We see it a lot in relationships.
So, I mean, that's so interesting to understand and find out that, folks develop these compensatory behaviors or maybe unhealthy coping skills from childhood experiences. And what it sounds like you're saying is they're really not helpful when folks get to be adults. They might help superficially, but folks are grasping for straws in ways to contain or understand or deal with those emotions. And some of those are process or substance behaviors.
I think that the skills that we develop, the defenses that we develop, ultimately we practice them day in and day out, and they become very hardened skills. And when I began my early work and I talked about, as I said a moment ago, about looking at kids, you can take that child who becomes what is known as the hero child or the responsible child. They have wonderful strengths. They have the ability to lead. They can initiate. They can make a decision. But what happens is, and that's what's different about them than people raised in a healthier functioning family, it becomes very rigid. And so as they move into adult life, what that looks like is they have the ability to lead, but they don't know how to follow. They have the ability to initiate, but they don't know how to pause and listen. They become highly controlling. They had to problem solve as a kid, but their problem solving was from an all or nothing perspective. And so they often have difficulty seeing options that are in between. And so we recognize the strengths, but it's the rigidity that causes the problems for them. And it's what it is they didn't learn along the way. As in that case, I learned to initiate, but I don't learn to follow. I learned to talk, but I don't learn to listen, that kind of thing. We have the child who finds the safest thing for them to do is to sort of move into the woodwork and not draw attention to them. And they become what we think of as lost children. And these are people who are probably very good listeners and very hypervigilant. But they're also the people that don't know how to initiate, don't know how to put themselves out there, aren't going to let you know that they have an opinion, aren't going to let you know what their needs and wants are. When we talk about children from addictive family systems, these are kids who have not, with any kind of consistency, had their needs attended to. And for many of them, by the time they get into adult life, I always say they wouldn't know a need if it slapped them in the face. And when you don't know what your needs are and cannot attach value to getting your needs met, they're not going to get met. And no wonder you're anxious. No wonder you're depressed. And I want to say something about depression, by the way, with this person. One of the skills that people have raised with addiction and other kinds of dysfunctions today, we understand that too, is that ability to compartmentalize, such as when I leave the house at 10 years of age and I go to school. When I go to school, I don't talk about the fact I was up till 3 a.m. listening to my parents argue. I don't talk about the fact that I laid in bed and cried because my dad didn't come home tonight. I set that aside and I get focused on school. That's my savior. That's what saves the day for me. We become so good at compartmentalizing that today as an adult, we can struggle with a lot of mental health issues and yet still look good to the outside world. And that's where we see a lot of people who attempt to take their lives. And we didn't even know they were suicidal because they are what I refer to as closeted depressed. And today I hear people talk about them being functional people in their depression. And that comes from that skill of compartmentalizing.
So Claudia, you've so eloquently described the connections between childhood trauma and unhealthy coping skills, addictive disorders. What would you say to somebody who is an adult struggling with some of the legacies of these symptoms, who's seeking treatment? What would be your advice on first steps and how to integrate their family in that?
I think that one, you need to be working with somebody who really values, and some kind of therapist or counselor who values what we refer to as family of origin work. And that the reason we do family of origin work is to undo a denial process and to be able to grieve the losses in terms of what it is that's occurred for us. We do not go back and explore the past and talk about the past for the sake of blaming our parents. Our parents did the best they could with the resources they had, and it is the way it was. The purpose, as I said, is to undo a denial process. And what I'm saying about that is we may not deny that a parent had a drinking problem or a mother was depressed, but we deny our emotional reality and what it was like for us. Mm-hmm. And that becomes so honed and so practiced that I'm always say you can't be honest about what's happening today at 35 years of age, 45 years of age, when you continue to minimize, discount, and rationalize the first 20 years of your life.
That is so fascinating. So it's not so much a lack of recognition of the struggles of a parent, but more so the lack of recognition of the emotional effect on you as a child, it sounds like.
Yes. And that's just a piece of what you'll do in that treatment and recovery process. So we need to explore that past, that narrative. We need to connect it to present day. How does the fact that I spent so many years in fear affect me today as a parent? How does that affect me today in the workplace? Or how does the fact that it wasn't okay for me to go out and play affect me today in terms of my creativity with my kids and in the workplace or in my relationships? How does the fact that maybe I was the child that spent a lot of time in a fantasy world, that was my way of taking care of myself, how does that affect me in my choice of relationships? So when I say, how does my past affect me today, we need to get really specific. Mm-hmm. So we explore the past, we connect the past to the present, and then we also challenge the beliefs. What did I internalize about myself and the world and growing up the way I did? Is that helpful to me today, and or is that hurtful to me today? And then I get to keep those things that are helpful for me today, but I'm going to let go of those things that are hurtful. Like you can't trust other people. Nobody's ever going to be there for you. Don't ask for help. Handle it all by yourself. Those are the kinds of beliefs we need to let go of and create new ones in their place. And then we need to learn the skills, usually very basic skills, problem-solving skills, listening skills, negotiation skills, conflict resolution skills. So there's a very clear process to me for recovery for the person who's raised with addiction. And that's in terms of handling the family of origin work, because by then we also many times are also being treated for a primary addiction or being treated for a primary depression. And I think so oftentimes people feel that you can't address all of this at one time, and you can. We used to believe you only could address one issue at a time, but that's no longer true. That in fact, if we don't address these underlying issues of traumatic stress, that we won't have the potential outcome and opportunity in terms of our primary treatment for whatever it is you're being treated for. For the person who's addicted, the addiction becomes its own primary issue. It's not about just addressing those family of origin issues and suddenly I'm going to be able to drink again or I'm not going to have these addictive behaviors. It takes on a life of its own and becomes its own primary issue. So you do need recovery from the addiction. You do need tools in terms of coping mechanisms for the anxiety, for the depression, for the self-harm. There are very specific techniques we can use with people that are very help in that process. But where people have missed the boat is leaving out that sort of what I call that adult child framework, not paying attention to that underlying traumatic stress and not naming it for what it is. Sometimes today, people are engaged in various kinds of mindfulness practices, which should be part of anybody's therapy process, by the way, and just personal life, because that in and of itself is very regulating for those of us who emotionally have been very dysregulated so much of our life. And so while that practice is extremely helpful, without connecting it back to our past, to our present day, we're going to be missing a significant piece in our recovery.
Gosh, this makes so much sense. I was watching a show the other night, like a reality show, one of those like Beverly Hills things, and the lady was saying, well, I have a therapist, I have a childhood therapist, I have a process therapist. And I was thinking childhood therapist, but it all makes sense now. It all makes sense when you talk about that really being a specific focus that folks often neglect in therapy.
And I don't know that people always need to have 3 or 4 different therapists, so to speak, because there are therapists who can integrate all of that today. I don't want people to think that they have to find a specialist for all these different things like you do in the primary medical health field today.
Yes. Thank you for making that distinction. Yes.
But I do want people to know that the help is out there. And that today, a lot of what I'm sharing has become much more common knowledge for the therapy world. Now,
yeah, and I would say, like, as you know, as we're kind of summarizing here in your career, for folks listening, Dr. Black has a comprehensive library of resources for clinicians that are even topic based. So you have one for strategies for depression for clinicians, anger for clinicians. So you've given back so much to the healthcare world, I think, both in your advice to patients and family members directly, but also in your mentoring and your strategies and techniques for fellow clinicians. So as a fellow clinician, I so appreciate that. We're so grateful, clinician to clinician. And if there's any clinicians listening, definitely check out Dr. Black's work. Super helpful. And she really is pioneering and was talking about these important issues before a lot of other people were. So thank you so much, Dr. Black, for joining us on the Well Aware podcast. I hope you guys listening found this as instructive and enlightening as I did. If you'd like to learn more about family systems and addictive disorders, be sure to check out all of Dr. Black's books. They're on Amazon. I was looking at some a couple of days ago, so they're all there. Super fascinating information, both for patients, families, clinicians. Thanks for watching and listening today. Make sure to follow us on social media. And most importantly, make sure to do something nice for yourself today. So until next time, take care.
Thank you, Dr. Lauren. Pleasure to be here. Truly. Thank you.
Thank you so much.